I'm pleased to support the motion and commend the member for Waite for bringing it to the House. As she mentioned, she has spoken on a number of occasions since her election to the Parliament about the challenges that she has personally seen with endometriosis, and in doing so has spoken on behalf of many women and girls in South Australia, many of whom, of course, have felt unheard at times, sometimes for extended periods of time in their life where they have maybe not been taken seriously by not just family members or members of the community, but also by medical professionals who ought to know better and in too many cases think that they know better. Endometriosis is a condition which causes extraordinary pain to many people on that regular basis, and I think the member for Waite described it very well. And I commend the member for Frome and other members who have spoken for their description of indeed the impact on somebody's physical well-being. And of course, when that physical pain is repeated and profound, it has impacts on people's mental health as well. That dread, that fear of the return of the condition, the return of the pain, and sometimes, of course, in the experience of a number of my friends and colleagues who have spoken to me about their personal experiences with endometriosis, that unending return of the chronic pain, of the profound pain, and significant challenges that has on their daily lives. The days where it's very difficult to get out of bed. The experience of undergoing treatment, which can be, of course, really profoundly challenging in itself. And then the uncertainty of knowing whether or not that will have significant lasting improvement to the quality of life thereafter, or whether they will be consigned again to further pain and financial cost as well. I have extraordinary sympathy for those endo warriors who continue to press on despite their pain, despite their condition. I look forward to reading the committee's report. I didn't serve on the committee. The Liberal Party was represented by the member for Frome and the member for Unley on that committee. It's being tabled this afternoon and I look forward to reading it in due course. I don't think I'm going to be in a position to be in the chamber to participate in the debate tomorrow, when I understand there are some people coming into the chamber at the gallery to observe the discussion about that report. But I can promise members and indeed those other people who are interested that I'll be taking a keen interest in it going forward and what the recommendations are and how the government responds to them. I'm sure, based on the discussion that has come in this debate today from members of the committee and indeed members such as the member for Mount Gambier who observed the work of the committee, and particularly in the way that it engaged with people in regional areas, I am confident that it will have addressed some of the issues that I have raised and will raise in my brief remarks now. But I trust, firstly, that one of the key aspects that hopefully is being addressed is in addressing the standards expected of our doctors, of our healthcare professionals. I was very fortunate to be the son of a midwife, somebody who did their nursing training at St Thomas's, who worked all over this planet as she worked her passage on holidays and ultimately her travel to Australia, and which she worked in Aboriginal communities in the Northern Territory. She's worked in multiple states of Australia, ultimately in Adelaide, where she found her home, and then I was very fortunate that she decided to settle in Adelaide, and that's, you know, the greatest privilege of anyone's life, to be born in South Australia and given the opportunity to live in this amazing state. But prior to her coming to Adelaide, as I say, she worked all over the world and all sorts of conditions. And my mum, how can I put this respectfully to my friends who are doctors? My mum always encouraged me in the belief that a doctor is obviously a very smart person. They've done a lot of work to get there. But there are occasions on which sometimes there are doctors who feel that because of the eminence of the position that they hold and the training that they've gone through and years and years and years of being told that they're the smartest person in the room, there are occasions on which they have blind spots on the things that they don't necessarily know. And I guess in Mum's reflection, it wasn't to do with endometriosis, but it strikes me as valid in the criticisms that I've heard from a number of people who've suffered from endometriosis, and I use the word suffered advisedly, suffered from endometriosis in their lack of empathy, the lack of belief of their description of their pain as they've been talking to medical professionals who they feel have let them down, and by every sense that I've been able to gather from the circumstances I have heard, it certainly sounds like they have been let down. I think that there is obviously research into the condition itself, but there's also education of our medical professionals about where that research is up to and the best ways to provide treatment. But apart from anything else, let's start with empathy and let's start with understanding, and let's start with the acknowledgement that women and girls presenting with symptoms, pelvic pain and other symptoms of endometriosis should be taken very seriously. One of the small measures in which I hope that I've played a positive role in assisting as we confront this is through education processes. In 2018, when I was made Minister for Education, given that extraordinary honour and privilege which I served for 4 years, one of the first people who came to see me was a woman called Libby Traynor-Parker, who I'm sure is known to many members. She worked in this building for a while, unfortunately not for somebody represented in either of these chambers, either of these sides of this chamber, but we will forgive her for that. Libby is a tremendous South Australian, a former teacher, a broadcaster. She has been an advocate, she has been an entrepreneur. She's an extraordinary woman. Libby, using her social enterprise initiative and her teaching qualifications, was a key player in developing the Pep Talks program with the Pelvic Pain Education Pelvic Pain and Endometriosis Foundation. Forgive me if I've got the acronym wrong. There's a lot of double P's in these acronyms. Libby came to the Education Department with a proposal that had some level of support from Health and the federal government, but it really needed the Education Department both to provide some extra financial support and indeed the willingness to work with the foundation to get this program in our schools. And there were I don't think, yes, it wasn't a cabinet document. There's nothing that prevents me from sharing. The advice from the departmental officials was that this wasn't great value for money. And their recommendation was not to proceed with it. They had, vague recommendations and suggestions to me that the department could maybe do some better work, or the department could work something up. But I was convinced that the advice was incorrect, and that the department, indeed, there were some tremendous people in the department who certainly, some of them may have agreed with me at the time, certainly I think some of them came to agree with me, that with a bit of extra resourcing and working with those other departments, as I've said, and the foundation, and particularly with the Education Department helping the foundation get that education program out into as many schools as we could, then that was going to have an important role. Because, I mean, that may have been a start. It may have needed further scale than the original grant was able to develop, but it needed to be proved up. It needed to be proved up because not only did the young women who were receiving those talks, those pep talks, and part of those programs need to hear that information, especially for those who might have been suffering pain that they did not understand and which their doctor did not have a solution for. But not just for those girls, but also for the boys in their class too. Because endometriosis is a condition that may only affect women. I think one of the other speakers said that it affects everybody, but the impact of young men or men in a sufferer's life who might not be taking their condition seriously is a serious impact as well. And so for those young men who are in the course, and I spoke to some of them after a session who said that they really appreciated learning more. People enjoy learning things. They enjoy learning about the things that impact upon their friends and their family members' lives. That was tremendously valuable too. So I want to congratulate all of those who were involved in developing the course. I know it wasn't just Libby, but Libby was the person who came to speak to me in my office, and so I singled her out. and all of those endo warriors, endo friendos, I'm not up with all of the latest jargon, but all of those people who continue to work as the Member for Waite has to enhance education and to improve the lives of people living with endometriosis in South Australia, I commend and acknowledging this important month.